For the next syndrome which we are going to discuss, this is what is known as the Maroteaux Lamy syndrome. Maroteaux Lamy syndrome. So for the Maroteaux Lamy syndrome, you can see people having it, okay, and you can see two patients from when they were a newborn up to when one was 13 years, when one was 26 years. So your hospital followed it up and gave us the pictures all around. So people have done a lot of research. So when I see things like this, I'm usually humbled, and I'm saying, bro, I'll keep working till when I'm like 90. I'll start having my holidays when I'm 90. So the Maroteaux Lamy syndrome is also known as the what? Mucopolysaccharidosis type 6. Alright, so it's a rare inherited metabolic disorder caused by there's a deficiency of an enzyme known as the Arylsulfatase B. So it leads to the accumulation of what? Glycosaminoglycans in tissues. So there's progressive what? Skeletal issues, cardiac issues, respiratory issues, a lot of issues. So genetic basis, mutations in the what? Arylsulfatase enzyme B. So okay, there's mutations in the gene, so the enzyme, the production of the enzyme now is affected, so there's what? Absent. Okay, so without this enzyme, the dermatan sulfate builds up in cells, damaging tissues and organs. Inheritance is autosomal recessive. Both parents must carry the defective gene. So onset and progression, symptoms usually appear in early childhood, though infants are typically normal at birth. It progresses, okay, and it's a long time in the life that, you know, some individuals will now have a rapidly advancing disease causing much more symptoms. So issues on the skeletal side, the person will be short, joint stiffness, spinal deformity. Neurological, having hydrocephalus or macrocephaly, the head is big, but intelligence is usually normal. Okay. Facial features, have a coarse facial appearance, cardiac issue, respiratory issues, sleep apnea, enlarged liver, enlarged spleen. You diagnose it from clinical features. Then you also do lab tests for the enzyme. Then you also do genetic testing to see that the gene is also mutated. Then urine tests, they usually have high levels of dermatan sulfate excretion. So treatment is you try to replace the enzyme that is missing. Okay. Supportive care is all those orthopedic surgeries, keep monitoring the heart, respiratory support, physical therapies, you understand, and the rest of it.